Welcome back. Technology and advancements in science are revolutionizing healthcare, including when it comes to heart conditions and treatments. We have with us this morning Dr. Eric Cooperstein, a cardiologist at West Boca Medical Center, to talk more about this minimally invasive surgeries and procedures that we're seeing so much more of right now. Doctor, welcome.
Thank you very much for having me. Appreciate it.
So what are some of the things that you have just seen change in the last 10 years or so?
Oh, it's kind of amazing, actually. I mean, interventional cardiology has taken a lot of advances in the past few years, whether it's just starting with balloons and then obviously going into stents. Most recently, I think the best approach that's changed in the past 10 to 15 years, the way operators do cardiac catheterizations. Classically speaking, it was done through the groin. Nowadays, we go through the wrist, actually. Wow. It changes how fast people can leave the hospital, how fast people recover. It used to be a procedure that was a recovery period. Most people go home the same day nowadays.
Doctor, how does a procedure like that come about? I mean, how do we get to the point where you can do it just right through the wrist?
Well, obviously, a lot of scientists and a lot of experienced operators have gone before me to go forward with that. But if you think about it, the wrist goes right to the heart, and it's a shorter approach. It's a much more comfortable approach for many operators, for the patients themselves, and it gets you out of the hospital even faster.
I know we've been talking a lot this month about heart health, since
Yes.
February is Heart Month, and so many doctors have told us too that the days of the big scar on your chest from open heart surgery is kind of gone, because
it's not completely gone. I wouldn't say it's completely. Everything has its own approach and time, place. Every time I tell my patient we go in, we're not going to know for sure what we see till we actually go inside there, and usually we'll have like one of four options when you go in for a procedure. Either everything's completely normal, or there's some disease inside the arteries that does not necessarily require any intervention other than just medications. Option 3 is that we put a stent in. And then option 4, unfortunately, is that you do still require surgery. You do still require that bypass surgery.
And what kind of patients fall into this category to be able to do these just very minimal invasive procedures?
Almost everybody can fall into it. I mean, it's the actual procedures are usually divided into two parts. The diagnostic portion, where we do the angiogram itself, and then on the spot, usually we make a decision whether or not we should put the stent in, or whether medical therapy, or if unfortunately they require surgery, then surgery it is.
And how has this changed when it comes to just the diagnosis and after that treatment, after that procedure?
So with respect to cardiac catheterization,
yeah.
and in respect to stenting and prognosis, it's an excellent prognosis. You get a stent in your heart for whether it's a heart attack or whether it's stable angina just because you're having chest pain. You can live a perfectly normal life going forward. You take some medication, and as time goes on, we can wean off some of the medication, but you can go back to living your regular daily life as it was beforehand.
All right, what else is going on in your world, doctor?
In my world, there's a lot going on in my world.
We don't have enough time for that, right?
Yes, but in terms of the cardiac point of view, we are developing a cath lab at West Boca Medical Center. It starts with the diagnostic portion. Obviously, if we get enough cases done, then we'll develop into a PCI, which means percutaneous coronary intervention, where we can put stents into the arteries over there, and that really helps the community of West Boca tremendously. Meaning, if we can open another cath lab there where we can do heart attacks, what we call STEMIs, that would help patients tremendously.
All right, great. Thank you so much for
Thank you
being
very
here.
much.
So nice to meet you.